So we're on the services screen again, and I'm just going to show you how to do your public health campaign feedback. It's important just to remind you that public health campaigns set by NHS England are part of your NHS contract, and all pharmacies must participate in the campaigns at the request of NHS England. Our Shropshire and Staffordshire team have told us what campaigns they want us to do. They have asked you to keep a record in the pharmacy on a tally sheet, and then at the end of the campaign you do need to come on here and use this module to record it. So the first date on here is just the date you complete in the form, which will always be today's date. So let's say this is your first public health campaign, so you pop the title in here. The first question asks if you're a Healthy Living pharmacy. If you are, you would click yes, and it will ask you the name of your Healthy Living champion. If not, then just click no, and you don't have to answer that question. So there's then a question about how you get your public health resources. So the questions are, did you order them yourself, or were these some of the resources that were going to come out automatically? For example, the last public health campaign we did was sent out automatically. Or did you not order? So if we said yes, we ordered the resources, then you will be asked, when did you order the resources? So if you can't remember the exact date, you might know roughly when you ordered them. So if it was towards the beginning of February, say, then you could go on and pop the date into there. And then the question asks, did the materials arrive? Yes or no? If no, then if you've got a reason, it might be despite repeated emails, nothing arrived, just as an example. If we change this answer and we say no, we didn't order them, it was an automatic thing, you still answer the question, did the materials arrive? If the answer is yes, that's the end of that section. If the answer is no, you can just pop in there, you've got no resources because they didn't arrive. And likewise, if you didn't order them, you're going to have to say why you didn't bother ordering them. So hopefully nobody's going to say no, they didn't order resources. So yes, we ordered them, and yes, they arrived. And I'm going to say I did them at the beginning of February. So were you able to run the campaign? If you say no, you weren't, you get a box here and you've got to say why. So again, if you didn't get the resources, you need to put some information in there, and if you did chase the resources, do say that, so that Public Health England can be chased up about that, and also NHS England know that you're meeting your contractual requirement because you are trying to run the campaign. But if you did run the campaign, it'll ask when you did them, so you can put the date that you started. If you started much later than everybody else because your resources were late, then there will be a place at the end that you can make a note of that, but at least you can show that you have run the campaign. And then remember the tally sheet, you've just got to know how many leaflets you've given out. Don't worry too much about this. It's not asking how many people read the leaflet. It's just asking how many you've given out. So if you got 50 and you've only got 2 left, then you gave out 48. That's what goes in there. You're asked to just jot down how many conversations about the topic you've had. And you might have done it in your pharmacy that a member of the team just spent one day talking to everybody that came in. You might have had a week, or however you did it, where you concentrated and you're going to count those conversations. And also you're going to keep a tally of how many people you gave general advice about the topic. Specifically, you might have found some people that you had to refer in to either the GP or a walk-in centre. Referrals to this might be people that you've referred to places like social services. It could actually have been referral to a patient support group. So it could be anything like that you pop in there. And wouldn't it be marvellous if we had some good news stories that we could report? So if you've got anything in there that we can share, it just helps us to spread the word about how great community pharmacy is. And that's it, save that. This isn't going to be every day or every week. This is only every time you finish a campaign. So you're probably looking, maximum would be 6 times a year, and possibly less than that depending on what NHS England set. We're coming towards the end of this year. If you haven't put any of this data on yet, You can add all of the forms for the whole year, because even if you haven't put it on Farm Outcomes, you might have a pile of data sheets that you can transfer the information. If you're wondering what to do in 2018-19, you will be getting some more information from NHS England about next year's campaigns and how they'll shape up.